Welcome back, everyone. Today, I'm joined by Dr. Zia Poonja, physician, health innovator, TEDx speaker, and co-founder of MyHealthspan. He brings over 10 years of experience as an oncologist and internal medicine doctor at BC Cancer, and now he's focused on extending not just how long we live, but how well we live. We talk about what MyHealthspan does, why HealthSpan matters, why our system is built around treatment instead of prevention, and how we can make proactive care less overwhelming and more accessible. So let's jump into it. So why don't we start by you telling us a little bit about yourself?
Sure. So Zia Poonja, I'm a medical oncologist. I treat breast and lung cancers. I'm also a health enthusiast, and I'm really interested in trying to prevent disease before it starts. And that's how I got involved with founding MyHealthspan.
And for those hearing about MyHealthspan for the first time, how would you describe MyHealthspan and what you do?
Great question. So, MyHealthspan is a preventative health platform built to help people stay healthy for as long as possible. We're combining advanced biomarker testing, DNA methylation, metabolic panels, all with grounded, clear science. And the goal really isn't to overwhelm people with data, it's just to show them what's going on in their body and what they're doing. So, in short, we're building an operating system for proactive health.
That's really interesting. And I think I've kind of looked through the website and learned a little bit more about it. And I noticed that there's a really strong emphasis on not just lifespan, but health span. Can you tell me more about that distinction and why it's so important?
Yes. So, health span is the number of years that you're healthy. Lifespan's the number of years you're alive. So the average Canadian lives to about 82. That would be our lifespan. Health span is the number of years of quality we have, the number of years that we're healthy, the number of years that we have without chronic disease. And on average, that is about 66 years. And why we fixate on that is we know with all the great advances that we're constantly hearing about in medicine, that we're doing a really good job of treating disease. And we're trying to expand that to try and keep people healthy, to expand those healthy years.
Something just struck me as interesting when you were speaking. I think that lifespan generally is longer for women, if I'm not wrong there. Is health span the same, or is there a difference there as well?
Off the top of my head, I would say certainly certain occupations, certain socioeconomic statuses, we know that there's determinants of health. So, and one of those is socioeconomic status or education level, and those are closely associated with different years of health span.
You have a really strong history and experience with a large breadth of different um, areas of medicine, it sounds like. What is it that made you want to start My Health Span?
So, the motivation came about with the frustration in our current system and understanding what our current system has been doing and doing really well. So I practice and I love my practice. I love treating people and helping people with cancer, and giving them the opportunity to experience more quality and quantity, and extend their lives. Um, there's something that can be built on that, that's much bigger than just one chronic disease. And that was that moment to say, hey, you know, our whole approach in medicine is quite reactive, and to change that, we think about prevention. Well, how can we prevent it? Because it intuitively makes sense. If we can prevent something from happening, why wouldn't we? But the way our medical system has been taught and layered is very much in a reactive form. And that's not, that's just the history of how we've sort of evolved. But now we're trying to create a different path. And that to me is really exciting. And it's almost a movement. And there's a lot of pivotal people who are playing a role in trying to explain that to people and show them that there is a way to be more proactive about your health.
I am so closely aligned with you on noticing that pattern and that history of um, more so a reactive maintenance versus a proactive maintenance. I think that the tides are shifting. That's something that my HSA is working towards right now too, is trying to push people to kind of go for proactive checkups and preventative care rather than reactive. I wonder if you might know why, historically, why is it that everyone was so focused on reactive rather than preventative all this time?
Sure. So, first, let's just think about medicine and how we've evolved. So, people had different conceptions of how we got sick in the first place. And then we have the scientific method that told us that, okay, there's actually some, good science and biology to, bacteria, viruses. We look at heart disease and like, okay, well, there's these arteries that surround the heart and they get clogged. And that's how. And if we look at that science piece, um, in medicine, we've always looked at disease and then we look at how to treat the disease. And that's how all our specialists have been set up. You see a cancer doctor after you have a cancer diagnosis. You see a cardiologist if you got a heart problem. You see an endocrinologist if you got really bad diabetes. And we develop these silos of specialty where we're learning the most about the heart or the metabolic system. And we're treating people with metabolic derangements or really bad heart disease. Um, and that's sort of how we've evolved as a medical culture. Um, it has been through that reactive approach. Now, in medical school, even, how much time did I spend learning about prevention? Very little. It's just not how the system was set up. Um, but when we take a step back and we see it for what it is in its entirety, we see, wow, there's this huge imbalance. And this imbalance has been really good for us because it's led to phenomenal innovations and understandings. But we also need to take a pause and focus on the other end, the prevention end. And that's the moment that we're in right now. And bringing that to people, helping them understand. The other piece is a lot of times there's this huge gap in health literacy and health understanding. So people have this sense that, or I get this sense that people feel like they're sitting ducks. It's like, I don't know when I'm going to get cancer. I have no control over my risk of heart disease. You'll commonly hear like, well, yeah, it really runs in my family. And all my parents have diabetes and or metabolic disease runs in my family. Heart disease runs in my family. So people have this sense that I'm a sitting duck. Like I don't have any agency over this, and that's what really irked me. Is hold on, I have a strong family of heart disease. My father was diagnosed with colon cancer, but there are things that I could do. My genes are such a small component of my risk. The environment plays such a big role. And that's where our opportunity is to educate and to let people know that they have more agency than they think when it comes to their health.
That's a revelation for me. I didn't know that genes were a small part of it. I'm part of that group that's always assumed, well, if my mom has, thyroid disease, I'm just going to have thyroid disease because funny enough, actually my mom has celiac and I think the statistic is 1 in 10 of a person's children could have celiac. That's usually just a statistic, but I'm actually one of 10. And so everyone in my family is always wondering who's it going to be? Who's going to be diagnosed with whatever it is that it fits into these statistics. You just assume that you don't have control over the full picture, like you're saying. I'm curious because you mentioned earlier that in medical school, you didn't really learn preventative medicine as much. There wasn't really a focus on that. So, in order to build my health span, how did you gain that foundation of knowledge to make it preventative rather than reactive?
Yeah, so I have a really good understanding of disease from my internal medicine training. And um, the rest was self study and looking at mentors. So Peter Attia, a mentor. His work has been pivotal in helping people to understand a preventative approach, and building on that just through self-education, and trying to get it right and trying to get it nuanced so that we're not scaring people, we're not putting people off. This is a journey, this is habit creation, this is education, this is education that needs to be done in a respectful way, that doesn't put people off. So it's been a journey, and it's been a really phenomenal one. And part of my love of medicine is in and for oncology in particular is this lifelong learning piece where you have a body of science that's constantly changing. How I treat lung cancer today was very different than how I was trained to teach lung cancer 10 years ago. The advances have been phenomenal. So living in that, being steeped in that, is an opportunity to innovate and make better.
If you could change one thing about how health insurance and healthcare intersect right now, what would that be?
Ooh, that's a tough one. Um, I think what I would do is change the incentive structure. Right now, we reimburse producers, not prevention. If we're even redirected to like a fraction of what we currently pay towards early identification and do things like blood work, metabolic screening, lifestyle coaching, we could dramatically reduce downstream burden costs. Um, and from a health insurance perspective, prevention should really be thought about as a huge investment, and there's downstream sort of benefits.
In MyHealthspan, what are the actual events that happen when someone logs in? Can you tell me more about that so that people can kind of understand what the journey is for a patient?
Sure. So they sign up usually depending. So now we have a few streams. We have the direct to consumer stream where people are able to sign up themselves through our website, myhealthspan.com. And then there's also the B2B end. So we have, clinics, we have fitness studios, we have companies that have decided to make this a priority. And they have a company sort of login that's a bit separate. There's a different process for it, and it ranges. We just try and our team works with whichever company that is using our services to try and make that the most streamlined as possible. And then the first thing you're getting is blood work. And that's the foundational piece because this is some introspection into what's actually going on in your body. What's your baseline? In fact, we call it our baseline panel. And that gives us a whole bunch of metrics, and we're looking at your cardiac health, metabolic health, liver function, kidney function. And we're throwing a lot of tech towards it because we've built a humongous tech asset with our dashboard. Because understanding your health is challenging. There's a lot of complicated medical terms that don't need to be complicated. They need to be made understandable. So we have a dashboard that uses color, that uses ranges to help show you where you fall. And then we have scoring. So we've developed our own algorithms to take those metrics and put them into scores. So we call it MyHealthspan score. We have a cardiac score, a metabolic score that is out of 100, but tells you where you're scoring to help you understand all this data. And then within each metric, there's explanations and there's what you can do. So actionable items to say, okay, well, this is what you can do. But that's not enough because healthcare, I believe, needs to be human. So you can build a really expensive dashboard like we have, but it doesn't work if you don't have a human component. And that's what we've really doubled down on at My Health Span is incorporating coaching. incorporating a longevity coach, people who we train in understanding the metrics. And that's gone through a lot of history as well. So we started with physicians, we started with nurse practitioners, and then we weren't getting the detail we needed. And we wanted someone to spend a lot of time with someone going through their metrics and helping them understand the dashboard. And we've hit the mark with our longevity coaches and the training program we've provided them. The feedback has come back phenomenal. And it's been helpful because now people have good understanding of what they need to do. And they're motivated to make the change for when they next connect with our team and our health coaches on their next draw, which is usually yearly.
Okay, I was just going to ask about the blood draw. So is that done at a specific lab or is that kind of a home lab? Like, how does that work?
Yeah, so getting blood work was the other piece. It's like there are so many. If I'm here talking about healthcare at agency, like getting it, you want to have some control. Think about getting blood work and all the steps that you need to find a doctor. Once you find one, get a requisition, then find a lab, then find a booking time, and then wait. So we just eliminate all of that. So the moment you're signed up, we have a text message that's sent and our team gets a hold of you, and someone gets sent to your house or your place of work, and they do a blood draw right there and then. So convenience taken care of, and the results are usually within a week. And we send an email saying, "Hey, check out the dashboard. Your results are up. Here's a booking link. Let's book an appointment with one of our health coaches."
That's awesome. The idea of getting blood work in the comfort of your own home, I think for a lot of people too, is just blood work is uncomfortable, but at least make it as comfortable as you can. So I really like that idea. And you said it's usually on an annual cadence, but if you had someone who has something that needs more constant monitoring, is that an option as well?
Absolutely. So, to our detriment, we have been very common sense focused. So we're not like some people will say, no, you get a blood draw as often as you can, like every 3 months. And I just don't think that for a healthy individual whose metrics are all generally in the right direction with a healthy MyHealthspan score, that they need to get their blood drawn, every 3 to 4 months. I think a yearly cadence is really important because things do change. Um, but for those that have areas that need to improve, that's where our health coaches are like, hey, yeah, here's your cardiac score. These are a few items that can really move quickly. Like within 3 to 4 months, we can see a really great change in these. Why don't we book another draw in 6 months to see if we're on the right path? And then we can fall back to yearly.
If the health coach finds something that is like a red flag, in those blood results and the patient, you don't want them to just look at their dashboard and have all these red flags everywhere. I'm not sure how it's visualized, and I'm sure you've made it less scary than that, but it can be overwhelming to be told that you have something. Does your team do referrals out to practitioners, or do you have your internal practitioners touch base rather than just the health coach at that point in time?
Yeah, so prior to the health coach, sitting down and going through their data, all our results are reviewed by a provider, a nurse practitioner, just to touch on exactly what you're saying. If there's some major red flags here, we need to let people know, and we have a reporting structure that's built around that so that, if there's something that's really abnormal, you need to go to the emergency department within 24 hours. Our operations team, Laura, is going to be calling you, texting you, and sending you an email as well to say, hey, this is what needs to be done. So we've built that safety layer in as well.
That's awesome. That's good to know, and I think that's really important to have that built in. And then on the flip side, I can think of certain patient types. I'm going to just call out my husband and say he's the type that goes, "Well, I feel fine. I feel healthy. Why would I need this? I'm I don't want to find anything out. Like if I go, I'm going to find something, but I feel fine." You know those types that are, I'll go to the doctor when it becomes a problem.
And for them, I just use analogies. I say, "Hey, what about a dentist?" You go for regular hygiene. Why are you going for regular hygiene? Because you know that there's value and you don't want all your teeth to fall out in general. And then let's just say they don't go to the dentist. I say, well, what about a car? Like, would you, you spent all this money on a car. Um, you're definitely going to go for some sort of oil change yearly. Because it's just not, there could be something they'll look under the hood, and there might be something that requires some attention. And for most people, that's like, yeah, that makes a lot of sense. And then I tell them, well, what about your biggest investment? Like you are your biggest investment. Um, and you're doing really well right now, but think about your car too. Like, you don't know when you're going to be running into issues. So creating those analogies helps people understand why we're doing prevention, because we're doing it in our daily lives, in examples like that. And we do it all without thinking.
Yeah, I think and I think there's also a lot to be said for prevention going hand in hand with optimization. So someone might say, "I feel fine," but do you feel great? Do you feel like you are working at the best of your ability? Do you still wanna be running and when you're a grandfather or grandmother, do you wanna be able to keep up with your grandkids, or do you wanna be the type that can't and has to sit in front of the TV all the time? Like, there's a lot to be said for prevention and optimization instead of just saying, "Well, I think everything's fine. We'll find," you know, we'll find out when
Yeah,
crap hits the fan or whatever. It's better to just get ahead of it, I think. So I really like that avenue.
totally. And what you're saying kind of resonates on this movement that we're building, what we've seen in workplaces that can be really infectious. So we have, workplaces that have signed up, and now all of a sudden there's this chat, this water cooler chat about your health. And I think back to a quote, you're only as healthy as your five best friends. And why is that? Because habit is so well entrenched with healthy behaviors. And then when we think about it from a workplace, 'cause right now it's, Jason has been chatting with a lot of workplaces, and and we're talking about some of the successes we're having there. And that's one of the big ones. And we can sort of even take it back a bit when we just think of health in general. A healthy colleague, a healthy partner, um, all of those attributes that come along with that are so infectious, and can be so wonderful for people to share in.
I agree. I know when I am on like I need to make it more of a decision, like an ongoing decision, but sometimes I'll get on a health kick and I'll just say, I'm gonna clean up my diet a little bit. I'm gonna do this and I'm gonna do that. And then it's so it is infectious. You see the difference. You see that then my husband will say, well, if you're eating a salad for lunch, I'll eat a salad for lunch too. Like it is so much easier to do this in community. And so to your point of, having a whole workplace go for this, I think could be really healthy in general for the whole workplace to get motivated, get ahead of these things. And I really I like that idea. I think that's something that people should be leveraging. Employers should be leveraging for sure.
Yeah. And we've seen success there, because and that's one of the pitches right now is, hey, look at the success we've had in that space. And think about what you're spending money on, chiropractor, massage, those sorts of things. And just think about what are the downstream benefits. And just give it a try to see how we can work towards changing culture. Because a lot of health is lifestyle and habits, which are really entrenched in our dashboard. And then all of a sudden, when you're actually having something really, physical done, like your blood being taken, it starts a conversation. And that conversation can be one that is shared, that is compared, and gets people on a new path.
Yeah, I think getting some like, to your point, getting something physical too makes it feel like a really tangible first step, saying, "Okay, it's easy to make a New Year's resolution, for example, and say, "Okay, on Monday, I'm gonna start going to the gym and I'm gonna start doing this," but that's all future planning, but actually taking the control and saying, "Okay, this blood work is the start of a journey, then I'm gonna find out what I need to do, and then I'm going to actually put steps in place." I think that that would have a lot more results? Like, do you see a lot of changes in behavior once people come on?
Well, that's what we're studying. Because part of this project is also a research project for me. to see, and that's why I created algorithms like scores, because I want to see these scores change over time. I mean, we're doing a research project right now where we're showing that, our scoring algorithm is related to all-cause mortality. So if you have improvements in your MyHealthspan score, you can be thinking about this as improving your all-cause mortality. So as a group aggregate of data, it becomes really interesting to see, is this movement that we've embarked people on, are we are we doing are we doing the right work? Because the metrics don't lie. And that's the other thing, is so much of health is ambiguous, and you know maybe I should exercise a little bit more. Maybe I need to eat these foods because this is what I'm seeing on my socials, and this is what people are talking about, or this is what I think is intuitively correct. um, but without some objective data, like some blood data, um, we don't know what we're dealing with. So I've said a lot there, but there's a lot of excitement in just the research opportunities here to be able to explain to people how membership can really improve their lives, and how we're doing this to our current group of people who have decided to join our movement.
Okay, you spoke on, like you said so much there, and I have questions that are popping into my head. The first question I have, because I'm a layperson in this area, can you define all cause mortality?
So the best way I could describe all-cause mortality is the total death rate for a population for every possible cause. So it's a really broad measure for overall health. It's used in longevity, um, and it's good at assessing the impacts of things like smoking, for example, or poor diet, or inactivity. Um, and it's, rather than focusing in on one specific disease, um, how to calculate it. So it's calculated by dividing the total number of deaths for any reason in a period by the total population. So almost always expressed as like per 100,000 people.
Hmm, interesting. Okay. That kind of gives color to it. I'm such a metrics person. And when you were talking about, the dashboard and having these numbers and you can see them changing in real time because each year you get your blood draw and everything, I think that would be really effective for people like myself who like to see. Like, I get kind of obsessed with metrics almost. Like, I work in customer experience, so NPS score and things like that. And I find that if I can see the needle moving visually, then I'm really motivated. So I like that idea of visualization of data on the dashboard. Another thing that you spoke about that I wanted to kind of pull on that thread a little bit more was, you mentioned the algorithms that exist in our social media versus the algorithms you're building. The social media algorithms, that was such an interesting point for me because a lot of times when I'm on these health kicks that I talk about, my Instagram somehow knows all of a sudden, maybe because I logged a workout on my smartphone or on my watch, I mean. And so it'll know. And all of a sudden, I'll start getting recipes and workouts and dietary changes and all of these things. But I find that there's like some toxicity that's laced in there because it could be because of my demographic, 32-year-old woman. Instagram knows that there's like a lot of vulnerability there. How are your algorithms built? I know you said it's based off the data and the blood work and everything, but how are your algorithms and the coaching built to make sure that you're actually personalizing it for, the patient in a way that's really healthy?
Yeah. So our algorithms are built based on what we believe to be optimal based on a review of the literature. So we're looking at a specific metric. We're taking a look and saying, okay, well, this is the optimal range, and this is the super optimal range. So this is the area where we really want to be. And our scoring, so first of all, the dashboard displays that. It shows the optimal range. But the scoring helps understand that a bit more, because we do a calculation. We do some bell curves, we do some math to show people, okay, well, you're here, and that corresponds to a My Health Span score of like 85. If you just improved your cardiac score, and then we break it out, well, your cardiac score is the one that's bringing you down to 85. It's preventing you from going to like 90. because your cardiac score is actually 76. And that's because you probably in the cardiac metrics, each of those metrics scored in the suboptimal range. So we did some math to help bring that to almost like a percent to help you better understand it.
Okay, so now that we've kind of framed my health span and the importance of preventative care, I do think that this podcast, if we have employers listening and advisors listening, is going to cause some attraction for sure. And I wonder if you have advice on what does a meaningful investment look like for advisors and employers that kind of want to leverage this preventative health care in their workplace.
So for employers, I would say, it's starting with us so that people can get their data. And I always tell people that it kind of like what I said before, you can't manage what you don't measure. And a really meaningful investment in employees is giving them the ability to measure, giving them biomarker testing, giving them personalized guidance and ongoing support. It's just the difference between generic wellness perks and true preventative health infrastructure. And this is new. So it's a big task for us to explain that to people and get them excited about it.
Yeah, and I agree with you there, and I think that if you kind of couple together, insurance sometimes misses the ability to bring on these kinds of add-ons, especially on a complete plan level. And I think that if you couple health spending account and a wellness spending account, then you can cover both the bases. You can get the lab work, you can get, the practitioners and everything like that. And then you can also get that coaching and the extras under the wellness plan. And like you said, it's not just some wellness perk that is more cookie cutter. It's something that actually means something to the employees. And I think that you really hit the nail on the head with that. Do you see a future where longevity testing and proactive care is as common as that dental and vision coverage we see in all benefit plans?
Absolutely. Because the economics will speak for themselves. Economics and outcomes of this approach make sense. So dental and vision treat quality of life impairments. Longevity testing prevents chronic disease. Dental also prevents chronic disease. And when employers see that metabolic health correlates directly with performance, absenteeism, retention, and they're able to see that in their workplace, this will become standard.
Yeah, I'd love to see that happen. So I'm going to shift now and kind of go into some closing questions. And I think that they're going to be the ones that might pique your interest the most, just based on what I've learned about you so far. So I'd like to know from your perspective, what is the most exciting thing about the future of longevity science?
There's so much, but the the biggest piece here is we're finally moving from theory to measurable, actionable biomarkers, things that we can test. Um, we have heart disease, but now we have advanced lipid testing. We have metabolic disease like diabetes, but we have, not only glucose testing, but continuous glucose monitors. Um, very soon we're having tests that are looking at y- trying to prevent things like cancer by looking at blood-based tests, looking at circulating tumor DNA and proteins. And these are available, but they're getting better. So our we're entering an area where you can finally actually quantify the impact of lifestyle, environment, and therapeutics on your biological age. And we knew a lot of that before from things like smoking. Like we knew that that was really affecting your biological age. We saw it in methylation patterns. We saw it in cancer rates. We saw it in just like overall survival. But we also know there's these huge environmental factors. And there's things that we can pick up on in your blood when you're stressed out and you're not sleeping well, and your metabolics. So there's just there's this movement that what we're seeing, where theory is moving to something that we can measure, and that's where all the excitement for me is.
Yeah, I think that's also where the excitement for me is. There's actually a lot more credibility behind it when it goes from theory to practice. I think you can always say, I think this is a hypothesis, but when you can say, actually, we have measurable results, we know this as data, this is actually a fact, there's evidence to prove it, that changes everything. Then you're going to convert the people that, are the type that are maybe non-believers in this movement. So I think that that's really exciting as well. And kind of pulling on that same thing, evidence-based. So if you could give people one evidence-backed habit to improve their long-term health, what would it be?
So single-handedly, I would pick exercise. It touches on every domain: metabolic, inflammation, mood, sleep, cardiovascular function, cognitive aging. If it were a drug, it would be the most effective therapy ever developed. And that drug company would make billions, if not trillions. I mean, right? I just saw a headline last week that Lilly just became the first drug company to be valued just over $1 trillion. And exercise doesn't even touch it. If we think about the best drugs that we have, and then we think of something like exercise and the number of domains that it touches, um, it would it would have to be exercise.
Yeah. Okay. I think a lot the same way you do on these things because I often tell myself, you know, drinking water is so inconvenient, but then I'm like, what if there was a drug out there that could, clear my skin, get rid of my brain fog, have more energy, make me feel better, and then I'm like, it's water. Just drink some water. And I think it's the same with exercise. If there was something that could lower your cortisol, get you, get rid of your brain fog and, weight loss and all of those things. And it's exercise. So I totally agree. If you think of it as kind of a habit, as if it was a drug, would you purchase it for hundreds of thousands of dollars? Probably. So it's free. Why aren't you just doing it? That really kind of closes the gap there.
Yeah, and exercise is a tough one, because you need to have an approach. In one of my projects, we're working with cancer patients and getting them exercising. And I do this with a professor out at the U of T, a professor in kinesiology. And I've learned so much about exercise from someone who's a PhD in kinesiology, and how even in that area, you know, how entrenching that habit and what levers that need to be pulled and what people need to do, and how the bar is really low. Getting moving, and is is usually the first step, but it can get more complicated. Um, but that's for another talk.
Does my health span work with kinesiologists as well? Or is that in the future plans?
We have kinesiologists on staff, but I think one of the pieces that you're pulling on is we work with gyms. And that's something I'm quite thrilled about. So we have some elite fitness studios that have partnered with us, and some fitness studios, just people who like this approach, where they're in there with a client, they know their client really well, and they're training them. And they're also giving them advice on, diet, exercise, habits. And then they're partnering with my health span to cover all the objective stuff, all the preventative stuff. And I think that combination is killer.
That is killer. I think that would be really powerful as well, and I think when we were talking earlier in another call with Jason, he was saying that with My Health Span, you can kind of put together like a package that kind of explains your health portfolio all in one document so that you can advocate for yourself with practitioners, trainers, coaches, and things like that. Can you tell me more about that as well?
Yes. So there's an AI element built into what we've created, that can help curate content from you based on your metrics. So you can chat with it, like, tell me more. The health coach gave me a big spiel about my cardiac health. Break it down for me in another way, or hey, I was told that there's some genetic aspects here of my cardiac health that lifestyle's just not going to cut it. Help me draft a letter to my doctor or give me talking points. Because I've raised this with my physician before, and they've said, I'm 40, I'm super healthy. I need to just like not worry about it. But give me the talking points and tell me what I should be asking for. And that falls into that advocacy piece of teaching people what they need to know about themselves so they can advocate for themselves in the most powerful way possible.
Yeah, I think that's also really important. I'm on this mission right now of giving employees and patients kind of control over not only the way they experience healthcare, but the way they experience benefits, because those are two things that feel very out of our control. From my experience alone, I know that there's been a long time of me saying, okay, I have this health experience, but I'm so grateful for the universal health system. But at the same time, there are some times that you just need more attention. You need a specialist without a referral, or you need someone who's looking under the hood a little bit more. And then on the same wavelength, your benefits might say you have all this for chiro and massage and things, and you're going, I don't need chiro and massage, I need this. So I think that I'm on a similar mission in our industry to kind of give employees control of their benefits. You're on a mission to give patients control of their healthcare. And between the two of us, we can kind of make it so that people have both. They can use their benefits to get MyHealthspan. They have control over how much they allocate to that. And I think that the whole industry, healthcare and insurance, is kind of going to move in that direction of more choice and control and taking your own healthcare more personally, which is the most personal thing that you can think of is someone's healthcare and their longevity. So that's really cool. It's a shared mission for us for sure. Thank you so much for joining us today. It was a really interesting conversation, and I'm excited to see where it takes us.
Awesome. Thank you, Danielle.
Thank you. Thanks for joining for today's episode of Beyond the Plan podcast with Dr. Zia Poonja. If you want to learn more about MyHealthspan, you can check out myhealthspan.com, and we'll include all the details in the show notes as well. And if you want to learn more about what MyHSA does, head to getmyhsa.com. If you want to hear more Beyond the Plan podcast, follow us wherever you get your podcasts and on LinkedIn. And thanks for listening.